Welcome to the Voice of Reason, where we ask questions that should be asked and hope that the answers that we are provided with, if we are provided with answers, help us to make informed decisions. In the wake of the COVID-19 pandemic and the action of governments to impose vaccination, especially in third world developing countries like Guyana, it is understandable that one would ask the following questions. Why are there clear disparities with the vaccines given to Guyanese and other developing countries relative to the rest of the world? Why are children below the age of 12 allowed to return to school for face-to-face interaction when adolescents must be fully vaccinated as a precondition for returning to school? Will this vaccination mandate be trickled down to children below the age of 12, that is from 5 and above, once the vaccine for 5-year-old children is approved? Why are we only copying all the questionable things from the United States of America and not the things that will make us a better society, like better wages and salaries, and the very principles of equity and equality in resource distribution? Why not Pfizer and Moderna vaccines? When the World Health Organization approved AstraZeneca and Oxford's COVID-19 vaccines, it was only for emergency use. Furthermore, despite the evolution of the novel coronavirus, the Food and Drug Administration has not given the green lights for the mandated use of these vaccines. Now, it's important to note that the US is sending abroad AstraZeneca Oxford vaccine it cannot use because its regulatory system has not yet approved its use. This is according to Martin Williams, senior news reporter for the Herald. This question gives rise to many legitimate concerns, especially considering its link to the rare blood clots known as CVSTs, cerebral venous sinus thrombosis. In fact, quite a number of countries have recommended that the AstraZeneca vaccine only be given to older people owed to this side effect. Moreover, in the month of April 2021, the Joint Committee on Vaccination and Immunization in the UK had recommended that healthy people under 30 be offered a different vaccine other than the AstraZeneca. These alternatives included Pfizer BioNTech BNT162b2 and Moderna mRNA 1273 vaccines. In Guyana, vaccination mandates are being imposed thoughtlessly, with little to no information shared about their risks, and very little research regarding the quality of vaccines being shipped to Guyana, an already divided small country which needs to build oneness to face the pressing threats against its borders. The truth of the matter is, people waver or are hesitant to take vaccines because they know the true effects of these drugs are not fully understood. And I repeat, they are not fully understood. Contrarily, we have jumped on board to vaccinate our children, when our children account for only a small percentage of COVID-19 infections. In fact, according to Alice Dear Monroe, who studies pediatric infectious diseases at University Hospital Southampton, UK, children's ability to neutralize the virus might be linked to the fact that they have a strong innate immune response from birth. It is therefore sad that we have subjected our children to an experiment that continues to unfold in unexpected directions. As of today, coming out of a BBC report dated September 13th, 2021, only one dose of the Pfizer vaccine is recommended for children. Why only one dose? Let's read what it says. The recommendation that only one dose be given, which the CMO said could be looked at again in the spring, is related to the risk of a condition called myocarditis, or inflammation of the heart muscle. There is a risk after one dose, but the risk increases after two, with between 12 to 34 cases being seen for every 1 million second doses. There is a risk after one dose, but the risk increases after 2 doses. And here in Guyana, we are subjecting our children to be fully vaccinated. That is, to have 2 doses of vaccines before returning to school for face-to-face engagement. The article continues, it says, and most of the benefits from the vaccine, which reduce the small risk of illness, are gained after one. That is, after one dose. Children aged 16 to 18 have only been told to get 1 dose currently. Many other countries have decided to give 2. This reinforces or reestablishes the point that these drugs, these vaccines, are not wholly understood. They are not holistically understood. And therefore, the evolution of the side effects, the nature of the very vaccines that we are subjecting, mandating our children and their parents to take, remains to be understood. It's important that we look to the WHO, the standards that have been set by the WHO as far as mandatory vaccination is concerned, that we consider the ethical issues regarding the distribution or the mandates of vaccines. And it says here, contemporary forms of mandatory vaccination compel vaccination by direct or indirect threats of imposing restrictions in cases of non-compliance. Typically, mandatory vaccination policies permit a limited number of exceptions recognized by legitimate authorities. Now it says at point 3, despite its name mandatory vaccination, it is not truly compulsory. It is important to note that the WHO does not accept liability for any damages or any health conditions that arise from the use of these vaccines. Here they are saying that the mandatory vaccination that governments are imposing is not truly compulsory. That is, force or threat of criminal sanction are not used in cases of non-compliance. It is therefore the kind of mandatory vaccination described at the beginning of this paragraph to which we refer in this document. Still, mandatory vaccination policies limit individual choice in non-trivial ways by making vaccination a condition of, for example, attending school or working in particular industries or settings like healthcare. Such policies are not uncommon, although it should be noted that the World Health Organization does not presently support the direction of mandates for COVID-19 vaccination, having argued that it is better to work on information campaigns and making vaccines accessible. In addition, WHO recently issued a position statement that national authorities and conveyance operators should not require COVID-19 vaccination as a condition of international travel. We look to the United States of America and we take pattern after them. But let us understand that as a developing countries, the challenges we face are unique and they require that we hold a united front, one people, one nation, one destiny, and confront this pandemic and confront the threats against our borders and not allow ourselves to be divided, especially by something that continues to evolve with each passing day, something that we do not completely understand.